Hi, Kevin Henry with Dental Economics and Dental Assisting Digest. I'm here today at the ICOI and ADIA meeting in Chicago. I'm talking to Christine Uhen, who's the head coach with the Productive Dentist Academy. And Christine spoke earlier today on the numbers that you need to know to run a successful business. And I wanted Christine to come on camera and kind of talk about some of those numbers. So Christine, what are some of those numbers they need to know?
Thanks, Kevin. Oh, well, the first thing you need to know is there is not just one number that you need to focus on in terms of success of a practice. But I think one of the most confusing numbers that you read in different magazines and hear from different coaches or consultants is the idea of a case acceptance percentage. And if you define acceptance as that the patient starts the treatment or accepts today and moves forward with treatment, what is a good percentage? What was a healthy number? I get asked that a lot as a coach. What should my case acceptance percentage be at? And if you think about it from a dollar perspective, let's say you present $50,000 worth of dentistry in a month and you get 100% case acceptance. That means I've got $50,000 of dentistry on the book. Is that better or is that worse than if I present $100,000 worth of dentistry and get 60% case acceptance? Now I have $60,000 on the book, but that percentage of acceptance looks significantly lower. So that number alone is extremely misleading in terms of what should it be. So again, it's a situation of taking one number and directing a practice based on only one number, which can be extremely misleading. So in terms of what is a healthy number, the real healthy number is what is my production goal for the month. So we look at that in terms of how much do I need to diagnose in order to accomplish that production goal. So from a Productive Dental Academy standpoint, we really look at what is it that I want to achieve.
Okay.
And then think about just in general, your patients have three choices. They have three answers to the question, are you ready to get scheduled with treatment? And it's yes or no, or not now. Okay, so with that, 1 out of 3 chance, why don't we look at, rather than a case acceptance percentage, a diagnostic ratio? What do I need to present to my patient base? Even assuming a 1 out of 3 says yes. Think about baseball. Okay, I'm not a big baseball player, but this story or this analogy I think makes a lot of sense. If I'm a batter and I come up to the plate, what's my batting average? That's a percentage or a number, right? And if I'm the dentist, and I think of myself as the batter, if I'm that person at the plate, then if I want that 100% case acceptance, every time I'm at the plate, I have to make contact with the ball. That doesn't happen in baseball. And isn't, like a 300 batting average like really good in baseball? Well, that's the 1 out of 3. So, here's a story that makes sense in sports and it makes sense in dentistry too. So if my goal is to produce $50,000 a month, why don't I look at diagnosing that 3-to-1 ratio? So as an office, my goal from a case presentation perspective is that $150,000, that 3 times as much. What it does for the team and the doctors takes so much pressure off of them. It's that standing at the plate, I've got to hit it, whereas now I just got to hit it 1 out of 3 times.
Right.
And that's really a huge load off the doctor in terms of feeling they have to be on, or the staff going, they have to say yes, I've got to hold my schedule tomorrow,
Right.
So it comes from setting the right goal, knowing what you want to produce, and then presenting to patients everything, not just that they need to have done. That's where people get 100% case acceptance. You have a broken tooth, we can fix it. They say yes. If you look at them whole mouth comprehensively, what should and could the patient have done, your diagnostics are only going to go up. That's where you can accomplish that 3-to-1 diagnostic ratio.
Okay. And one thing that I thought was very interesting is you talked about the not now part.
Yeah.
Yeah. And kind of tell our viewers a little bit about, if they say not now, what are some very common sense things that you should do to make sure that you can follow up and get to that yes?
Oh, that's huge. And again, a term you'll hear from the Productive Dentist Academy is retention. You want to make sure that when you have patients that come into your practice, they stay in your practice, that they don't come in as a one-hit wonder just for the deal that you're marketing. Maybe you'll see some direct mail campaigns that say, come in for this. Well, as an office, the real goal is to make sure that you retain every new patient in your practice and subsequently continue to keep them And in a dental office, that's through the recare cycle.
Okay.
So you always want to make sure that patients are committed to coming back to your practice for their recall cycles. So what's developed, if you do a comprehensive treatment plan for a patient, it doesn't mean that they're going to do all, let's just say even $12,000 of that treatment, but they're going to work towards it. And whether it takes 4 months or 4 years, this $12,000 treatment plan is what it's going to take to bring your mouth back to health.
Okay.
So they'll do it at the rate that they can financially and within their schedule get it done. As long as they're coming back for hygiene appointments, you've created, with this treatment plan, an annuity. So now every time a patient's back for a hygiene appointment, the hygienist or at their morning meeting, the team will look at outstanding treatment plans and say, hey, this patient still has outstanding work. Let's make sure we re-present that continued dental care because it still needs to get done.
Right.
So it's not about doing a comprehensive exam every time. It's looking at a comprehensive treatment plan and working through it at the patient's comfort level.
Great.
Of time and finances. Yeah.
Very cool. All right, well, thanks so much for your time, Christina.